Reason why I suddenly got under eye bags? What type of treatment should I look for? I'm 30 years old and suddenly got under eye bags. I hate my picture being taken now, and they age me so much. My mother has bags, but didn't get them until she was near 50. I've stopped smoking, about 1 year of no smoking, drink plenty of water, lost about 30 pounds thus far, take vitamins, sleep enough, doing everything I can to be healthy, but there's still no improvement. I'm thinking they are allergy or weight loss related. Creams do nothing. I have struggled with hormone issues.
Thank you for your question. You're 30 years old, you've submitted several photos. You describe very well in detail your concerns about this sudden appearance of under eye bags. And you state that in your family, your mother has eye bags, but she didn't get them until she was 50, while you've gotten them at 30. You state that you've lost about 30 pounds. You are taking vitamin supplements. You've stopped smoking, and certainly you're looking for options to guide you as to what to do. And I understand your frustration with taking photos. Well, I could give you a little bit about my background. I'm a board certified cosmetic surgeon and fellowship trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and probably the most popular procedure on the face I perform is under eye bags. And the reason, of course, is that it's very, very common. And under eye bags affects people of all ages and both genders and ethnicities. And it's definitely there is a family or genetic component. Within the same family, I've actually operated on 3 generations. And I can definitely understand the frustration you have with having bags under your eyes, especially at a young age. And you are right that it does age the face. I always tell my patients that one of the remarkable things about under eye bags is once you address them, it literally is like a facelift. So let's just learn a little bit about what your situation is. And of course, you've already stated that creams are not helping you. Well, the anatomy of the under eye bags is very straightforward. The under eye bags represent fat pockets that are normally around the eyes that push forward. Now, to understand that stressors can have an effect on accelerating the progression, however, genetics is still a very strong factor. The fact that your mother had it at a later onset doesn't mean it could not have happened at an earlier time. It's also something that a lot of times people will say to me, especially even if they're like in their 40s, they'll say, "Oh, I've had these bags since I was a teenager." Or as one patient said to me, she was born with those bags. Now, once you have the bags, what's interesting at this time is that there are a lot of different offerings of solutions, which is why people are probably more confused than ever. When I went to practice more than 20 years ago, under eye bags, really before the injectables and the radiofrequency and all the various non-surgical devices were introduced, essentially if you had under eye bags, you first tried creams. When those failed, which they always did, you then went ahead and had surgery. Now there's a lot of conflicting information when a regular person does research. So I'll share with you my approach in my practice. Yes, we do have some new technologies and methods. For slight under eye bags, I can help a patient by camouflaging that area by the use of a filler such as Restylane, hyaluronic acid filler, to soften the transition between the under eye bag and the surrounding skin. A lot of times I'll combine this with platelet-rich plasma, which is derived from your own blood, and that is used to help improve skin quality. A lot of times the under eye skin also needs a little bit of tuning up. And so the eyelid skin benefits from the volume as well as the platelet-rich plasma. But a lot of times people come to me who have had this approach done elsewhere, and unfortunately they end up with bigger under eye bags, or they have lumps and irregularities from too much material. And that's simply because a lot of times there's just too much fat prolapse to be addressed with an injectable. When it comes to the non-surgical options, I am really circumspect because I don't think that any of them really work out as well as some of the before and after pictures try to represent. There have been more than a few radiofrequency devices along the way that have claimed to be able to tighten up the skin to the point that the bags go back, but generally those don't seem to work very well. If there is only a slight amount of fat prolapse, then maybe there'll be a benefit there. We have a type of laser that we can actually just heat the fat from the inside the eyelid. But again, there's the specific indications which are fairly limited. In my practice, someone like yourself, a young person with lower eyelid fat prolapse, I would typically perform something called a transconjunctival blepharoplasty. Transconjunctival blepharoplasty means I would approach the fat pockets from the inside of the eyelid. That means reduction, repositioning, sculpting, whatever is necessary in order to get that contour to look good. Depending on your skin quality, I would also most likely consider platelet-rich plasma injection to improve skin quality. And depending on your skin type, I make a decision between fractional CO2 laser, erbium laser, as well as the use of radiofrequency technology, non-surgical skin tightening, such as Pelleve. So there are more than a few options, but what I think is the real advantage of blepharoplasty is that once it's done, it holds up for a very long time, particularly in a younger person. Patients who I've seen, who I did eyelid surgery on 15, 20 years ago, will come in and say they still look great, but then they'll say that it's time for me to do injectables or do a facelift. So certainly the longevity has value. I think you're also in a good situation where you've lost weight and you're living more healthy, and that certainly has a tremendous impact on the overall appearance of the eyes. I always point out to my patients that if you look at any American president from day one and how they look 4 years later, you see the stress of the job in their eyes. So I think that you're on the right track in terms of research, but I think you should meet with qualified, experienced cosmetic surgeons. Learn about the options and also in terms of the type of anesthesia. Many people are hesitant to have surgery because they're afraid of anesthesia. Well, in my practice, we do everything under local with LITE IV sedation. We do these in our in-office facilities, which are approved by the Joint Commission. So we try to bring in the familiarity and the minimal invasiveness that one would experience in like a dermatology office having lasers or injectables with the true formality of surgical suite and facilities like a hospital. So it's kind of like the best of both worlds, and in terms of the anesthesia, we just basically eliminate the risks of general anesthesia by doing this under local with a little bit of sedation. Our patients recover very quickly, and it makes this type of procedure much more palatable. I think that when people go chasing non-invasive procedures, it's with the fear of surgery and the avoidance of having hospitalization, general anesthesia, and things like that. So we've been very successful with helping people overcome that particular obstacle. And ultimately, the benefit really is very, very, very nice. So I hope that was helpful. I wish you the best of luck. Thank you for your question.